topic of today's Dr. Ozello Sports Medicine Report is shin splints. Very common injury among runners. Something I see in my office all the time. Very frustrating injury. It's an injury that can happen to runners and athletes of all levels. Any type of running athlete can suffer from shin splints. Doesn't matter the sport, doesn't matter if it's track and field, doesn't matter if it's recreational, doesn't matter if it's competitive. Shin splints are a common sports injury. They are preventable injury and they are something that you can recover from. Shin splints are pain that occurs in the front of the leg. It can be on the inner aspect or on the outer aspect. The inner aspect is what we call the medial side. The outer aspect is what we call the lateral side. The medial side is much more common than the lateral side. The medical name for shin splints on the medial side is medial tibial stress syndrome. Shin splints are a textbook classical overuse injury. Happens all the time. When we have an overuse injury, there's three things that are common in all overuse injuries. First of all, overtraining. Second one is inadequate rest between training sessions. And a third one is some type of faulty body biomechanics. The anatomy of the foot, the ankle, and the lower leg is quite complicated. There are numerous bones, numerous joints, numerous blood vessels and nerves and muscles in that area. When we talk about shin splints, like I said before, there's the medial tibial stress syndrome and the lateral tibial stress syndrome. In medial tibial stress syndrome, the main culprit is a muscle called the tibialis posterior. The tibia is the big bone that's in the lower leg. You can see it on an x-ray. It's the bigger bone. The fibula is a smaller bone on the outside. The tibia runs all the way down. This big bump on the inside of the leg is what's called the medial malleolus. That is part of the tibia. The tibia connects with bones in the foot to form the ankle bone. The muscle that I mentioned, the tibialis posterior, that originates on a large part of the tibia. It originates in the back part, up at the top, and slides downwards, and its tendon wraps around the foot, wraps around the medial malleolus, comes down onto the foot, and attaches to several bones down on the bottom aspect of the foot, called the plantar aspect of the foot. The tibialis posterior, when it contracts in a concentric manner, does several different motions. The main thing that it does is what we call inversion, where it turns the foot inwards. So you think about, muscle originates up here, tendon runs down, wraps posterior to the medial malleolus, wraps around the foot, and attaches to the bottom of the foot. So it's pulling the muscle in this direction. It also does what's called plantar flexion, where it's pulling the toes away from the front part of the lower leg. So it's basically doing this type of motion. When we step while walking or while running, the normal biomechanics of the foot, there is a motion called pronation. Pronation occurs when we step down, the foot, the heel strikes the ground, the foot comes down, the foot and the ankle roll slightly inward, and then we press off. That is the normal biomechanics of the foot. It's called pronation. Hyperpronation or overpronation is a biomechanical fault that can lead to many injuries, including shin splints. As I mentioned before, all overuse injuries have at least one biomechanical fault, and the main one with shin splints is hyperpronation. Hyperpronation occurs when there is too much inward rolling of the foot. The foot rotates too much, it puts too much pressure on the ankle and on the muscles in the lower leg. The tibialis posterior has to function really hard when we are running to help to control hyperpronation. What happens is that when hyperpronation occurs, it continually stretches the tibialis posterior. And there is so much stretch being put on the tibialis posterior and so much demand putting on the tibialis posterior when it's working in that eccentric fashion that it starts to pull away from the bone where it originates at. The covering of a bone is called the periosteum. Periostitis is an injury where the covering of the bone, the periosteum, starts to actually pull away from the bone, if you picture it like Velcro. What happens in shin splints is that in the medial tibial stress syndrome aspect of shin splints, and we're talking about the tibialis posterior, is that the muscle starts to pull away from the muscle. Gets so much stress put on it, it starts to pull the periosteum, the covering of the bone, away from the bone. That is where the pain originates from. That is the source. The origin of the tibialis posterior is fairly big. That's why the symptoms of shin splints are felt through a wide range or a wide space in the lower leg. The symptoms of shin splints are deep-seated, dull, achy, throbbing pain, tenderness, possible redness, maybe swelling, maybe little bumps that you feel along the skin. These symptoms occur in a location where the muscles originate at. It's like I spoke about. It's periostitis. The muscles are being pulled away from the bone. Usually these symptoms are worse in the morning, and also when we are running or we're walking, when we start getting fatigued, that's when these symptoms may worsen. The hyperpronation, the biomechanical fault that exists, when we combine that with repetitive trauma of running, that is the source of the injuries. When we speak about any type of injury, but especially an overuse injury, there are contributing factors. There's the intrinsic factors and the extrinsic factors. The intrinsic factor is the biomechanical fault that exists. I mentioned that several times already. The intrinsic factor of shin splints is weakness in the foot muscles that causes the hyperpronation and the collapsing of the medial longitudinal arch. Also, weakness of the tibialis posterior muscle. The extrinsic factors: overtraining, insufficient rest between training sessions, inadequate nutrition that is going to help us to recover from our training sessions. So these are things that we want to think about. What I mentioned very early in this video is that shin splints is a classic overuse injury because it combines the extrinsic factors and the intrinsic factors. There's the overtraining, there's the insufficient rest, and the biomechanical fault. What we want to do to prevent this injury is to eliminate the contributing factors. We eliminate the extrinsic factors and the intrinsic factors. When someone suffers symptoms of shin splints, we want to eliminate the factors also. So we want to combat the formation of shin splints by eliminating the intrinsic factors, strengthening the feet muscles, stretching the calf muscles, strengthening the tibialis posterior muscle, preventing the hyperpronation, correcting the biomechanics in the foot, the ankle, and the lower leg. All those things are going to help a great deal to help to prevent shin splints and help to recover from shin splints. We want to modify our training. We want to train hard, but you want to train smart. You want to give yourself adequate recovery time between your training sessions to help to eliminate these contributing factors. Shin splints is a condition that is very common among runners. It doesn't matter if they're beginners, if they're intermediate level, if they're advanced level. This is something that can happen to anybody. You can become overzealous and train too much in the very beginning when you are restarting a training program. That's when the injury starts to occur. So we want to formulate a good training routine, one that includes cross-training, one that includes strengthening of the entire body, strengthening the heart, strengthening the lungs, strengthening any weak spots that we have, eliminating those faulty biomechanics. Also, your training routine has to include adequate rest and good nutrition to help yourself to recover. If symptoms have occurred, get professional help. Have an evaluation, have treatment by a doctor of chiropractic. Shin splints is something that I see in my office quite frequently. I treat a lot of athletes. Shin splints is something that occurs quite commonly. When I am treating someone with shin splints, I'm looking at the biomechanics of the foot, the ankle, the lower leg, the knee, the hip, the pelvis, the lumbar spine, the entire spine basically. We're looking at the entire chain. We call it the kinetic chain, how things work together. The body is one synergistic unit. We want to make sure that everything is moving and functioning the way that it should. If I have a patient with shin splints, obviously I'm going to do a consultation and examination to figure out what they have going on. What exactly is the individual things that this person's body is doing and where do they need attention. Most of the time with someone has shin splints, I need to do chiropractic adjustment on the foot, on the ankle, maybe even out here on the fibula bone, on the hips, the pelvis, and the lumbar spine. That's going to help to restore proper skeletal motion, help to restore how the body is moving and functioning. Also, what I'm going to be doing is when I'm adjusting the spine is that's going to bring proper nerve flow from the spine going all the way down to the muscles in the entire lower extremity. The nerves that branch off the lumbar spine, they go into the low back, into the hips, legs, feet, and toes. Nerve signals are transmitted through those nerves, and then they go down to the earth, they come right back. Happens just like that. If there's an impingement on a nerve, that nerve signal is interfered with, that nerve signal is impeded, that can lead to weakness in that muscle, that can lead to other symptoms also. So we want to eliminate any nerve impingement that is present, and that's what chiropractic care is going to do. Also, patient education. Patient education is huge in chiropractic care. If I have someone with shin splints, I am going to teach them stretching exercises for the calf muscles, strengthening exercises for the foot, strengthening exercises for the lower leg, and any other exercises that they might need to correct their biomechanics. They may have something going on in the thigh or in the gluteal muscles that contributes to their shin splints. So we want to correct those faults also. We want to correct the biomechanical faults. There may be a muscle weakness, there may be a strength imbalance, there may be muscle tightness. So we want to correct all those. That's what patient education is going to do. When I'm speaking about shin splints, there are several key things that we need to do. First of all, like I said, strengthen the foot. We want to help to prevent the hyperpronation. Now, if someone has a foot that is collapsed all the time, we're not going to be able to heighten the longitudinal arch, the medial longitudinal arch, but we'll be able to strengthen those muscles around that. And that's what the foot strengthening exercises are going to do. And then we want to stretch the calves, strengthen the tibialis posterior muscle. I am going to create a playlist, so after this video, you can watch the videos that I've done on calf stretching, foot strengthening, and strengthening exercises for the tibialis posterior. Those videos will help you a great deal in your prevention and your recovery from shin splints. Patient education is so important. Professional care is so important. This is an injury that, if not treated properly, can continue to reoccur. It can be obviously performance limiting, and it can be quite frustrating. So you want to get this taken care of. If you can prevent it, by all means do it. If you do have symptoms, seek professional care and start your self-treatment immediately. Return to activity when you are suffering from shin splints is individual. It's different for everybody. Some runners, they will try to push through shin splints, especially if they are intermediate or advanced level runners. What I recommend to them is that they just modify their training. If they want to do recovery runs, which is a slow, shorter run than what they've been doing, that's fine. If that has worked for them in the past and they know what they're doing and they are going to listen to their body's signals. If someone is a new runner, if they're a novice runner, I recommend that you modify your training, you take more days off, you do less hill work, you shorten your mileage, and you do less speed work. You want to do less running to ensure yourself that you're doing more cross training and more recovery. The day after your most intense workout or your most intense run, you want to do a stretching day. You want to do a rest day. Whichever day you want to do, on that day, you want to make sure that if you do any type of activity, that you don't want it to be affecting the same muscles that you just trained very hard the day before. I recommend that you do the day after your toughest training day should be a recovery day, active recovery day, where you do your stretching, you do your foam rolling. That's when you get your chiropractic treatment. That's when you get your reflexology, whatever tools that you use. That is the best day to do those because it's going to help your body to recover even better. Cross training. Cross training is important for any type of injury prevention and any type of injury recovery. You want to do your resistance training. You want to make sure that you're strengthening your heart and your lungs. If you need to take time off from running, you can do other types of exercises. You can do swimming. You should be able to get on the bike with no problem. If you are riding the bike, you want to make sure that your heel is contacting the pedal or the midfoot is contacting the pedal, not the forefoot. Because you don't want to be pushing into plantar flexion because that may irritate your shin splints. May not, but it might, so it's better to be on the safe side. So return to activity for everybody is a little bit different. Just recommend to you that you listen to your body signals and you train smart. Give yourself time to recover from your training sessions. In conclusion, shin splints is a very common sports injury, especially among running athletes. It's a chapter in my book, Running, Maximize Performance and Minimize Injuries. Chapter 14, page 84. Shin splints is a preventable condition and it's a condition that you can recover from. Modify your training so that you are training hard, you are training smart, so you stay injury free, you can accomplish your goals. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.